Awesome. Well, thank you so much, Miranda, for setting this all up and giving me the honor of being one of your speakers. My name is Esther, legally He Young, and so Esther, Dr. Ing, whatever you want to go by, whatever day it is. I am a clinical behavior resident in my second year of residency under Dr. Amy Pike, who is a board certified veterinary behaviorist. Our hospital is the Animal Behavior Wellness Center, and we have two branches. We're located in Fairfax, Virginia, and Richmond, Virginia. And the Richmond location is actually headed by Dr. Amy Learn. So it's two different Amy's. And that's what we do all day, every day is see behavior cases. So I'm really excited to talk to you about, does your dog actually need medications? Because that's something we deal with every day. So without further ado, let's get started. All right, so what are we going to talk about today? So behavioral versus medical, I wanted to touch upon briefly because the question is always going to be, is this actually a truly behavioral issue? And if it is, like, how do I know? What medications do I need? And then what kind of products are out there? Medications. There are other things like pheromones and supplements. And then, of course, the big question about what about CBD? And then I want to touch also briefly on the great work that Every Dog does, because it isn't just medication when we talk about behavior therapy and changing the emotional response of our dogs. It does take the combination of medication and environmental management, setting that dog up for success. Behavior modification. And then lastly, I wanted to explain what do I do every day? What is a veterinary behaviorist and how is that different from your primary care vet? So those are the biggest things we're going to cover today. The slide that I have here, I always like to include cute pictures if I can to help make it just memorable. The phrase that we say all the time in our field is if there's a sudden onset of a new behavior that's problematic or the worsening of a previously managed behavior, our catchphrase is it's medical until proven otherwise. So that really means that you should seek out your primary care vet if something suddenly changes in the way your dog is acting. And a lot of people know now that the first signs that our animals show us that something is not right inside is a behavior change. So your vet is going to be the first one that you contact, and he or she may choose to run specific diagnostic testing based on what they presenting complaint is and what their exam shows them. A physical exam, I can't stress the importance of that. It may look like it's really quick, but those doctors have trained a long time, and there's actually many, many things that they're assessing in that moment. So it is something that we highly recommend, as well as during that time, they may complete an orthopedic exam looking at that musculoskeletal system, and then a peripheral neuro exam. A lot of general practitioners can't do an MRI with their eyes, and they might not have a MRI machine easily accessible in their clinic, but they can do what we call a peripheral neuro exam, where they just make sure at least the big neuro areas of like the eyes and the mouth and the feet, they're all kind of working the way they should. And then we can go into actual diagnostic testing like blood work, urinalyses, because we want to make sure, is this dog acting differently because there's a new liver disease or their thyroid values are too low? Are they in pain? And we'll talk about that more. So the rest of those diagnostics that vet will determine based on your discussions and their exam. One of the things that they may choose to do if they have access to it is called digitherm. So those are the imaging that you see with all those colors in the middle of this slide, because we sometimes can't tell with just our naked eye, right? So x-rays can show us some things, and digitherm, I'm looking at the temperature difference in reading around the body in the left knee versus the right knee, or maybe the right wrist versus the left wrist. We're looking for comparisons and making sure, are there areas that might be showing discrepancy?
So y'all, if you're in the chat, I think the last thing that we heard Dr. Eng talk about was diagnostics and assuming medical until proven otherwise. If you remember exactly where we were before she dropped, let me know. Did we get to pain and GI health? Maybe, I think so, because we were talking about not heat maps, that's not the right word, temperature changes.
Yeah, thermal temperature reading.
Yeah.
Okay. Can you see the screen?
Yes. Do you
Okay.
want to hit the different view, the slideshow view?
Yeah, I'm just gonna do this because last time that didn't work, and we're just gonna
Yep.
make it really tiny and hope that
Perfect.
you all can see it.
Perfect.
Now tell me one thing, if I stop my video, does that then stop the screen sharing?
Nope.
Okay, you don't need to see me. You just have to hear me and see the screen, and I'm hoping that that might help with my computer. So if y'all don't mind, that's how I'm gonna continue.
Perfect. Can someone in the chat make sure, can you also see the screen, the pain and GI health? And can you hear Dr. Eng? Just give me a yes or a thumbs up so I know. Yes. Okay, perfect. All right, let's do it.
Okay, I'm so sorry, everyone. Thanks for bearing with us. Okay, so with our gut health and pain, essentially, we know that the first signs of underlying discomfort are shown and exhibited through behavior change. So the whole goal of this slide was to tell you that there are a lot of medical diagnoses that may impact our animals and result in behavior change. So super important to reach out to your primary care vet first and let them know what your concerns are, and then follow the plan. And the one thing I wanted to mention with the GI health was that we hear a lot of times that dogs are historically picky eaters, or they do things like, I don't want to take treats unless it's like really fancy cheese, or things like that. And a lot of times that underlyingly means that there is some level of anxiety. Because if you think about rest and digest versus fight or flight, those are very two different areas of function for us. And you can't really engage in the resting and the digesting, which is the eating and digestion system, when you're way too anxious, because you're really just focused on like survival mode and taking in all of your stimuli. So an anxious individual may say, nothing tastes good, I don't have an appetite, and they may be, quote, picky. So always something to consider for your dog if that's something you've worried about. Okay. Oh, well, let's see if I do it this way. I'm like hesitant to touch anything on my computer now. Okay, so all that means is if we go through your primary, you do some diagnostics and you don't see anything medically concerning, then of course proceed then with behavior therapy and treatment. Now, if you do find things that are different or off or acute change medically, of course treat it, follow your vet's advice. And then if the problem behavior also resolves, well, great, yay. If it remains, though, I don't want you to be completely discouraged. Sometimes the medical disorder was just a contributing factor that now being resolved is the residual association of not feeling well is remaining. So, for instance, I use the example of car nausea. I don't know if y'all heard it, but some dogs express a lot of anxiety when they're about to get in the car, and they maybe truly had some motion sickness. And your vet can say, all right, well, here's some medication for the nausea, and the dog feels better physically, but the underlying emotion associated with that unpleasant feeling of the car remains. And so therefore behavior therapy and potential medication would be helpful. So we're going to continue down that road. And at this point is, well, does my dog really need medication, right? So I wrote on the left-hand side the words intensity, frequency, and recovery. What that really means is when we think about concerns in behavior, we have to assess if those different factors are abnormal. All right. So I gave you a little bit of definitions from a behavior textbook for anxiety versus fear versus phobia. So, anxiety can be displayed in the absence of a stimulus. I feel uncomfortable and fearful, but there isn't an identifiable stimulus present. Fear can be expressed in the presence of a stimulus that that animal or individual perceives, and it seems like a threat to them. But it may sometimes be a normal response to help them respond to their environment. A phobia, though, is when the abnormal response may occur without the presence of a true threat, or it's just out of proportion of what's needed to deal with that trigger. So we consider those more maladaptive because they interfere with normal function. So if we think about that then in the factors of intensity, the frequency, and recovery, well, a dog who has very high intensity in the realm of phobias would certainly benefit from a medication. If the frequency is very high, such as, every single time they see another dog, they can't help but go to level 20,000, then yes, medication would be helpful. When we talk about recovery, that means when that dog has experienced that stimulus that they consider fearful or anxiety driving, how long does it take them to recover and be okay once that stimulus or circumstance has resolved, right? So, I use the example all the time. If my dog is always upset seeing other dogs on walks, how long does it take? Does it take him an hour to feel better after he's been acting like Cujo? Or does it take 30 feet and 5 steak treats for that dog to start to feel better again? That's what we consider for recovery. And if these factors are high enough and intense enough and frequent enough, right, that's when we want to say, all right, I think I need to consider medication. And then we can talk about then the goals. So the goals are, of course, decrease the intensity, decrease that frequency, and improve that recovery, right? But we always want to use it together with behavior modification and management of the environment. Now, there's different types of medication, and I'll talk about those in a little bit, as well as their side effects. But if you notice here, there's not a lot of side effects that we see very commonly. So I want you to know that as a whole, most of our medications are considered very safe to be given long term, and we don't worry about organ damage or like premature cancer, anything like that. So I'm lucky I get to prescribe things that are generally safe to use. Excuse me. So then we want to touch upon, well, it doesn't always have to be medication, right? If there is a milder degree, it's more of a fear or an anxiety that you don't think is too intense and maybe could benefit from some help and some behavior modification, but you're not quite ready for medication yet. Pheromones are natural products technically in that category, because it's not like a chemical that we've created in the sense that it's from a natural concept. Okay, so people are usually more okay with pheromones. They're used as a communication cue between individuals of the same species. So if you look here, because we're talking about dogs today, I didn't include like feline pheromones, but if you have a dog and a cat in the same house and you plug in both a dog and cat pheromone diffuser, you're not going to interfere with one or the other. Like the cat's not going to feel it from the dog and vice versa. The pheromones, that concept actually came originally because if you think about those ants, right, they use a trail of pheromones to help members from like their colony get to the source of the food and return to the nest again in the most efficient manner possible. That straight line, right, as much as it can be. So pheromones come in a few different forms. The ones that were most familiar with the branded products, which I will always recommend over anything else, it was called Adaptol, and now it's rebranded as Thunder Ease. They create a collar as well as a diffuser and a spray. And Zenadog also has a collar and a diffuser. Now, I have transitioned a little bit to preferring the Zenadog diffuser over the Thunder Ease diffuser just from the fact that it lasts longer. And if you look, it's one of those like gel capsule diffusers where it's not plugged into an electric outlet. So you don't have to worry about it taking up an outlet. It doesn't get too hot. And you just open that top and it has like a foil top to it. Think about your car air fresheners that you put in like the car cup holder, right? It's kind of like that, but it has a dog pheromone. And the point of the pheromone is that it's called dog appeasing pheromone, so we call it DAP for short. And that is the pheromone produced between the mammary glands of a mother dog who is like nursing her puppies. And so it has a very affiliative, calming property. Like, it's okay, like mama's here and we're all friends here. We can all come together. We don't have to guard a nipple or anything. So it's really just supposed to provide that calming message to our dogs. So that's what pheromones can do for us. Now, with nutraceuticals, that is more what people think of as like supplements, right? So I know that Miranda and I talked a little bit earlier about like Zilkine. So here we are, Zilkine. The active ingredient for Zilkine is alpha casozepine, which is just milk protein, essentially. So that old adage, like drink a warm glass of milk before you go to bed because it's calming. The reason for that is because it has an affinity for our GABA receptors, and that can really have an anxiolytic effect for us without causing the side effects of those benzos. So we really like it as a natural product, and those are the studies that were done in cats and dogs to show their efficacy. Now, Angzitane is another supplement, and its active ingredient is L-theanine. It is the active ingredient that you might associate with like green tea. And so y'all know that green tea has been known to have calming properties as well. If we think about it from a scientific basis, what L-theanine can do is increase our GABA, our serotonin, and some of our dopamine. And so those are the neuroreceptors that we're going to take advantage of to help produce that calming effect. I do encourage people, if they're thinking about supplements, to again use the branded product. Try to get it from a veterinarian if you can. I always worry because supplements and natural products are not regulated by the FDA. Unless it's a branded product like Zilkine and Nangzitane that's given to you from your vet, there's no guarantee what's in that bottle, right? Like no one's going through those bottles and like testing the capsules to make sure what's in what. So unless it's branded like this, I do stay away from others. And Angzitane, L-theanine as an active ingredient is noted in some other products as well. The one qualm I have about some of the other brands out there, though, is that they've labeled it for once a day dosing when it really should be every 12 hours. And so I do prefer Angzitane as my product for L-theanine. Okay, now this is just a personal plug for me. Speaking of Zilkine, I, as a resident in clinical behavior, am doing a research project, and we're using a product that is Zilkine plus fish protein that's been proven to help with mild to moderate signs of anxiety. And so it's a fully remote study. And if you're interested, the information's on our website, but the QR code is there. It was just a plug for me because we're basically using Zilkine. So yeah, if you're interested, either let Miranda or me know. The QR code is right there if you want to scan it. All right, now moving on. So for diet and nutrition, that can impact behavior too, right? So of course, for our dogs, we always want a high quality diet that's formulated for our, canine patients, right? Now we do want them to have grains just from the research and things that we found that was correlating grain-free diets with development of heart disease. And so if it's possible for your dog, like they don't have true sensitivities, then I would prefer it to have grains. The protein content listed there as less than 28% is because the study that was done quite a while ago when we used to use the word dominance aggression, so try not to focus on that part. But the study that was done showed that the dogs that had higher levels of protein content actually were more prone to aggression. And the reason for that is that tryptophan is one of the lowest concentrations of amino acids, so it's less available. So a lot of the other types of proteins are going to be metabolized first, but tryptophan is the precursor to serotonin, and we know we need that to cope with our stressors. And so in the sense of that, the takeaway is we're looking for, on a dry matter basis, which is what you'll see as the percentage on the back of those bags, about 28% or less. And then we're going to talk about probiotics. So remember, I had stated in the beginning, when my computer was acting wonky, the importance of gut health and the brain. And of course, we have clearly proven that many times with human medicine. And there is probiotics out there to help overall with gut health. The one that we consider most for helping with decreasing anxiety is called calming care. So the active ingredient is BL999, and that organism really communicates through the vagal nerve to the brain, and it really helps for dogs. Say like your dog is boarded and they always end up having like stress colitis or things like that. It can really help with those types of dogs because it gives you that probiotic, but it also gives you the one that was researched, I think it was in Cornell, and found that it can help reduce anxiety signs. Now, when we talk about true medication, then there are two broad categories. The faster acting medications, we can sometimes call them event or situational medications, and then the daily medications. Daily medications you give every day at the same time, no matter what happens. Event or fast acting medications we use in anticipation of a particularly stressful event. So going to the groomer or going to the vet, or sometimes for some dogs, it's the car travel, right? So the different medications I listed there are the most common ones that we use in combination many times. So Trazodone, most people are quite familiar with, and that one is used about 2 to 3 hours prior to your stressful event, as well as gabapentin is about 2 to 3 hours to onset of action. They both last about 8 to 12 hours based on the metabolism of your particular pet, and then it's just gone from their system. So that's why it's just for those particular events. Clonidine is a different class of medication and takes on average about 90 minutes to start working, and then wears off in about 6 to 8 hours. And commonly, I will start with a combination of the first three, or like a mishmash of like one or two of them based on the severity of anxiety and the trigger. So some people will say, well, going to the vet is the most scary thing. Maybe we'll do all three. Or I think going to the groomer is not as scary as going to the vet. All right, maybe we only pick one or two based on the mechanism of action of the medication and what really we're aiming for. And that's chosen by your veterinary behaviorist by the actions that your dog is expressing to say, I don't like what's going on. Now, Cilio is the little gel syringe that I have as the picture there. It is our fast-acting medication that's FDA approved for noise phobias like thunderstorms. And it only takes about like 10-15 minutes to start working, because you're not going to have your dog ingest it, but you're actually going to rub it on the gum or like the cheek pouch, and it's absorbed through there. So it actually starts working very quickly. The benefit of applying it that way also, if you're able to, is that it gives you that calming effect without having too much sedation. My own dog with the storms today, I gave it to her, and it does help her very quickly. So I do like that as a medication that's very fast acting. So those, sudden onset storms, or if you live in an area where people just like to set off pop rockets and you can't do anything about it, Cilio may be your friend. It does tend to cause paleness at the location of application just because it's a vasoconstrictor. So if you apply that to your dog's cheek pouch and all of a sudden it's really pale, I don't want you to be worried. That's what we do see, and the dogs are okay. The last fast-acting medication are benzodiazepines. So people are sometimes familiar with this. So that's going to be like your alprazolam, lorazepam, those kinds of medications. they tend to take about 60 minutes, sometimes 30 minutes to start working and also wear off quite quickly. And the range of how long they last can be anywhere from just a few hours to like 8 to 12. And that really depends on the medication. Those are also used for our dogs for specific events, such as going to the vet sometimes. But I tend to shy away from that initially and reach for the top three first because our benzos are the one medication where we may have disinhibition of our behaviors and can inhibit our learning. So I don't really want to reach for those unless my dog is truly panicking. So say I have a separation anxiety dog who's really, really upset and panicked, I may reach for that benzo sooner because that's what helps the most with that panic. All right. Now, our daily medications, I really only provided you pictures of two because these are the ones that are FDA approved for our dogs. So, Reconcile is dog Prozac, basically, and Clomicalm is dog branded clomipirine. So, fluoxetine, Prozac, Reconcile, it's all the same thing essentially. But again, I like my branded products for the stability of what's inside. So if I've heard stories of people who are on, say, like Zoloft, and they get their pill every month from their pharmacy, and one month it's this like green oval pill, and then the next month it's this pink round thing, and they do feel different. I do believe them that that can happen because a generic product, you don't have to show that it has the same consistency every time. And so I do want a branded product for my psych meds if I can do that, right? Sometimes I don't have a choice. And again, these are really the ones that are FDA approved for our dogs that we use most commonly. And so I will veer off of those if I have to, if they're not responding well to these medications. But the branded ones are what we prefer. Reconcile as an SSRI, and then Clomicalm being a TCA. They just work differently. We'll say the most common side effects, again, for the Reconcile are those GI side effects like mild suppression of appetite or a little softer stool, maybe some nausea or spit up, but I don't expect that to last very long. It usually is just that dog's gut getting used to the extra serotonin, which starts to happen in usually about a week or two, and then they get better, and you don't need to go to your vet for that because they'll get better on their own. Clomicalm has a little bit more of a side effect profile, and I actually try to take advantage of it sometimes. It's also FDA approved for separation anxiety, and I'll use it for my smaller dogs who are showing that anxiety by having a lot of like urination or defecation or drooling, because it can have some basically drying up effect. So I will be cautious with it with my dogs who have a tendency for, say, dry eye. But if the dog is really leaking everywhere as part of their anxiety, I may actually use Clomicalm and take advantage of its side effect. Now, Clomicalm is a twice a day medication, and Reconcile is the only one that's once a day. So be aware that the dosing, you're going to follow what your vet or veterinary behaviorist recommends for you. All right. Now, the big question that I know has always been on everyone's minds as well. What about CBD? Okay. And Miranda, on time wise, I know because we had the mix up. Do you want me to just keep going through, or do I need to stop at a certain point?
Nope, you can keep going as long as you've got the time for it.
Okay, yes, I'm perfectly okay. So CBD, the best formulation is oil. That's what our studies show us. So if you're going to choose a product and you can do it in an oil, that would be the one we prefer. The downside that I'm going to say is the studies that show the CBD having beneficial effects are really focused on osteoarthritis pain management. Okay. And so when we think about anxiety, you're going to see really soon that the end conclusion is it's a meh at the lower dosages. So the study that was published in 2020 unfortunately did see that as we start to increase our dose, which we always in veterinary medicine calculate the milligram of that medication per kilogram of body weight of the dog. And so they tried it at various dosings. You can see it went from 1, 2, 3, 4, and 12 mgs per kg. They did it for 28 days. in the dosages that were 2, 3, 4, and 12, they did see changes in a liver value ALP within 1 to 2 weeks of treatment based on the dose. So it isn't just a product that can do no harm, is what I want to mention. That as you go higher, it can cause liver value elevations. The most common side effects that we saw with the CBD studies are hypersalivation. So I had the picture of the drooly dog there. They do some lip licking, which can be a sign of anxiety or nausea. And so then vomiting could follow, and then the loose stools and dehydration. So those were the most common side effects. But my worry is that the higher you go, the liver elevation did start to increase. Now, the research that we have the most about is the product Elevet or Elivet. I don't know which one is the right way to say it personally, but I say Elivet. And so that product comes in a few forms. The oil and the chew, I think, are the most common ones. And Dr. Lisa Rodasa, she's a veterinary behaviorist down in Florida, and she did some research for them. And the focus was looking at storm phobia. Now, the 2 milligram per kilogram dose that she started off with those dogs is what they did their original research on, in again, I think with Cornell for osteoarthritis. But unfortunately, with the noise phobias like storms and fireworks, it didn't really have an effect at that same dose. So I worry when people come to me and they say, "Oh, I'm doing CBD because it's out there." Well, is it doing anything? Right? I worry about that. The way they assessed if there was an effect or not was they looked at salivary cortisol. So, cortisol, our stress hormone, they were looking at that. And then they also recorded the dog's body language and what they were doing, and assessed that for signs of anxiety. And that's where they were able to say, no, I don't think that it actually had an impact. They tested it then at 2 milligram per kilogram, then 4, and then 6, and then 20. And so at 2 and 4 milligram per kilogram, no effect really noted. 6 is where they started to see some impact. And then the most profound change was at 20 milligram per kilogram. And that change is that they finally looked like they had like more of a drug like effect, where they were walking and then they fell asleep in the room, even with the storm sounds, and then they walked out of the door. But the problem I want to, circle you back to is we also have research that says the higher you go, it can impact their liver. And so it makes it so that the benefit probably is not outweighing the con, right? Um, so then she also has looked into the literature about like, is it just sedating them? Like, what is it doing? They were looking at activity level, and the dogs that they did that for, they were looking at the dogs for about 4 hours a day. No people were present. They looked at dosages at 2.5 milligram per kilogram versus 5 milligram per kilogram. And really, there was no change to the energy level compared to baseline. They did see some dogs express less scratching behavior, but it wasn't considered statistically significant when they analyzed that data. But since they did see less scratching behavior, maybe we should assess it for treatment of atopy instead of anxiety. So apparently there are some dermatologic studies ongoing. We just don't have that out yet. Now, the other thing that she looked into was looking at CBD alone versus Trazodone, one of the medications we mentioned already as an event med, versus the third group was Trazodone and CBD, and tested to see, are they less fearful of firework sounds? FAS, which I say they didn't see a change in, FAS stands for fear, anxiety, and stress, and that's a scale that a lot of veterinarians use to assess what level of anxiety is this dog feeling. They also looked at serum cortisol, and unfortunately, even though they saw effect for the trazodone levels, they didn't really see anything for trazodone and CBD lowering the cortisol as much as the trazodone alone. So their end conclusion again was that it's unfortunately not effective for managing noise phobia. And then I did want to say that amidst all these products, we always want to focus on this threefold approach of, okay, we've got some products that's going to help make our behavior modification training more efficacious to help keep those dogs under their panic threshold and really learn, but also super important to manage the environment to help them stop practicing the behaviors and the emotions associated. All right. So then the last question was, well, what's the difference? Like what happens if I go to my primary care versus a veterinary behaviorist? So a veterinary behaviorist, very briefly, is a licensed veterinarian, and they can prescribe medications, the things that we're talking about today, as well as formulate a treatment plan that's inclusive of that behavior modification and give you tips for management to help make progress in addressing your dog's anxiety. And it is different than people who have like PhDs in behavior, or are like trainers, because unfortunately they can't prescribe medication. We partner with these people often, but the difference is that a veterinary behaviorist is someone who can prescribe medication. And then they can also have that medical background to assess medical history and really partner with your primary care vet to say, hey, when I look over the medical record, I notice they've always had that low appetite, or hey, I noticed that there's this new lameness that we might have missed. Let's work that up to make sure that that's not another trigger and factor that might impact that dog's behavior. A diplomate is someone who has completed a 3-year residency program, which is what I'm in currently. And then we have to also publish original research and teach and take a bunch of classes. And then we get to take a really fun 2-day exam. And then we can say we're diplomates. But even before that, we are fully fledged veterinarians, and we work under the mentorship of the boarded behaviorist. So sometimes you're kind of getting 2 vets for 1 when you work with a resident like myself. But yeah, that's the biggest difference. We work with your primary care to make sure we're managing usually the psych meds, because we don't get a lot of that education in vet school. All right, so I wanted to end to provide you, just some resources if you have dogs and cats. The cat book is Decoding Your Cat, and Decoding Your Dog, of course, is for the dogs. And these were both written by the diplomates in the College of Veterinary Behaviorists in America. So I love those books. And then I wanted to do one last plug of saying there is a really cool podcast that my bosses put on, and they answer a lot of really good questions. I think one of their first episodes was about medication and like, is it going to make my dog a zombie? And no, that's not our goal. They had talks about separation anxiety. I think this time they're going to have one about CBD with Dr. Radasta as their guest. So encourage you, if that's something you like to do, to listen on your car ride. Behavior Buzz is what it's called. So with that, I'll end my talking time and be open the floor for any questions.
Awesome. Thank you so much for that. Y'all, I know we went through a lot to get to this point. I'm really excited about it. My caveat here is we will get to a bunch of questions. We are not going to answer any individual medical questions about your specific dog. So if you have questions, please ask something general that we can ethically answer, since obviously Dr. Eng doesn't have time to get to know each of your dogs during this phone call legally. So a couple of quick questions. Someone asked, how long does Cilio last?
Great question. Cilio, yeah, because I talked about how long the others last, and I realized I didn't for that one. It lasts 2 hours, and you can give it a maximum of 5 times within a 24-hour period. Because it is absorbed through that mucosa, we do recommend that when you are applying it, that you wear gloves, like just plastic gloves, and then put it on the gum or inside cheek of your dog.
Okay, so 2 questions that go together. One of
Okay.
them said, could hind end licking and chewing be an anxiety-related behavior, which many things could be. And the second question is, what are some behaviors we should be looking for to determine if our dogs are exhibiting signs of anxiety?
Yeah, so the first question with like the hind end chewing and licking, the reason I focused on, making sure there's nothing medical going on. Chewing and licking behavior can be, of course, a sign of itchiness. Sometimes there's deeper underlying pain, right? Like a joint disease, or maybe like a little thorn or something like that. So that's why it's super important to make sure you check that out with your vet first. But yes, it can be a sign of anxiety. Sometimes we start off in our behaviors as ways to cope with a normal stimulus, right? Like I was itchy, and then that itchiness might resolve because you took them to the vet, but it continued as a coping behavior outside of that original normal context, and that may be related with anxiety. So unfortunately, it is a kind of it depends answer, but you're right, it could be a sign of anxiety. And then, sorry, what was the second question?
Common things we should be looking out for in our dogs that might be indicators of anxiety.
Oh, okay. I would defer to there is a really good chart. Lily Chin is an artist that I really love, and she creates these really nice infograms. But things like that. So I hope maybe I can find the link and put it in for you, or Miranda, if we
Yeah, I'll see if
send
I
it.
can grab it.
Yeah. So some things she puts on her poster, which are signs of anxiety, are like panting in the absence of excessive heat or exercise, a lot of lip licking behavior. The whale eye is one where like you see the whites of their eyes. Another is this very hyper vigilant activity where they don't seem like they can really relax. Others maybe, let's see. Yeah, those are kind of big ones in the facial area. I tend to tell people not to focus too much on the tail because that one can get kind of confusing. But yeah, another one is like the one paw up, like just one paw at the front, like raised up, and they're not trying to do a cued like shake behavior or anything like that. So yeah, those are just a few to get started. But Lily Chin's infographic has a lot of good ones that are easy to digest and remember.
Yep. And she also has a teeny tiny dog body language book that's
Oh
really
yeah,
cute that you
we
can
love
buy.
that
It's really
one.
cute. Okay, this was, I thought, a really good question. Essentially, that someone's vet told them that if they used anxiety meds, came off of them, that at some point, if they tried to use them again, they wouldn't be effective again the second time.
Interesting. I don't know that I've heard of that as a actual like controlled study. So I don't have anything that I can point you towards as a resource to cite for that one. Um, yeah, I don't know where they got that information. I can't give you a good one for that one,
Yeah,
unfortunately.
I suspect, and I really like that question. I think one of the tough things, and we see this all the time, is there are so many factors at play most of the
Yeah,
time. So there might be folks where they come off of meds and they decide they want to go back on them, but so many things have changed that they might be saying, oh, the meds didn't work as well this time, but it could be so many other pieces that
yeah,
are indicated there.
I love that.
Okay, let's
That's a
see what
great
else
point.
do we
Agreed.
have. Okay, doggy catnip, total hoax or possibly good for
Oh,
calming?
I haven't actually heard of doggy catnip. Like I know of catnip genuinely,
Yeah.
for cats. I've not really heard of doggy catnip. That's a new one for me. Does whoever asked that question, I don't know if you have a link or like know what the name of that product is for me to like look it up really
Yeah,
fast.
Vicky, if you wanna message me, we can talk
Yeah.
about it. Okay, how long do pheromones take to take effect, and can they be overused?
Oh, they can't be overused. That's a good question. How long they take effect is generally the diffuser to build up really in the room sometimes can take up to 72 hours. A lot of times it's like a 48 to 72-hour interval that it takes for those diffusers. The sprays and the collars actually start working faster. The spray really, we use it more for like putting it on a groomer or a vet so that they're exuding this pheromone before they go into an exam room. And the only thing we ask people to do is wait like 10, 15 minutes after they've sprayed themselves. It's more so because we don't want the smell of the alcohol to be kind of abrasive to like the dog's or cat's nose. So I think it does work quite quickly for like the sprays. And then the collar, I think it really is maybe just enough time for like the heat of the collar to start to like help diffuse the pheromone. So not that long.
Awesome.
Mhm.
Can gabapentin be used daily as an anxiety med?
Certainly, yes. We do use it for some of our patients where, for instance, there's concurrent pain that you already know is there. So maybe a dog who has chronic skin disease or ear infection or arthritis, disc disease, had surgery, right? Now, know though that our dosages for pain are at a lower range than for anxiety. So if you go to like a surgeon and they prescribe you gabapentin, most likely they're going to prescribe you the lower dose focusing on pain. If you come see me or another veterinary behaviorist, we're going to prescribe the higher dosages because we're going to address the pain and give you the portion that really starts to focus on relieving that anxiety. But it can be used every 8 to 12 hours in conjunction with any of your daily medications or by itself.
Awesome. Okay, in situations where meds have caused disinhibition, does this
Mm.
go away over time with continued use of that med, or does that generally indicate that this isn't a med that's safe to continue for that dog?
Yeah, I wouldn't continue. Like, I'm mostly talking about benzos. I don't really worry about disinhibition with like our daily medications, like the doggy Prozac. It's really the benzos, like the Xanax, that I worry about it the most. And then it's just not a right fit for that dog because aggression, we define that as a distance increasing behavior, right? And if my dog is feeling scared, which is usually when we're using those meds for, I don't want them to feel like they're going to be, you know, doing that with with more disinhibition, less disinhibition. How do I say that? You get what I'm saying, though. Like I would say, don't use it for that dog. But knowing that just because they express that disinhibition with one benzo doesn't mean that they'll do it for all of them. So sometimes we have to say, all right, your brain didn't really agree with Xanax. Let's try some lorazepam instead. So just know sometimes you have to work with that a little bit.
Yep. And from the behavior consulting side as well, I think we sometimes see folks that put their dog on a med and then they expose their dog to higher than normal levels of the scary thing. And then
Yeah.
when the dog shows aggression, they go, oh, the meds did it. When sometimes it's just like, we hoped the meds would fix everything. And then maybe we got too close to something that was scary.
Yeah.
So it is important. Sometimes I think folks think they're seeing disinhibition when really they're just seeing a change in their management.
Yeah. That's a great point. Yeah. I love it.
Okay, what would be your elevator speech to a dog owner who is resistant to considering meds for their dog?
It's not really an elevator speech because it probably takes longer than an elevator ride. But I do encounter a lot of people who are hesitant with meds. And the biggest analogy that I use for them is imagine that you are at the top of a roller coaster. And whether it's out of excitement or fear, really you're just focused on, like, oh my gosh, I'm at the top of the hill, right? And in that moment, if I were to sit right next to you and say, hey, let's relearn some calculus, it's not going to work, right? And so I need you to come down. I need you to not be so close to your threshold for learning to take place. And that's really my goal with medication. It's not to make your dog a zombie or just sedate them. I just want to help them feel better about coping with their triggers so that they can learn. And that would be my spiel for saying, hey, I think medication would be helpful to facilitate everything else, not be so frustrating.
Yeah, absolutely. Okay, we got another question, and I'm going to change the wording. They asked about a less activating SSRI choice for a highly anxious dog. I think they just mean daily med. So is there a less activating daily med that's a better choice for a very anxious dog versus a more fearful dog?
Less activating. May I ask what that's? I'm not quite sure what that means. Like, yeah,
Yeah. So what I think this person is referring to is more of those like amped up the like neurotic when you think of like maybe
uh-huh,
our border collies that tend
uh-huh,
towards neuroticism and
uh-huh.
being like sort of high octane, like they're
Ah,
they're overly versus the ones who are trembling in the corner. I think that that's what they're
that's
referring to.
exactly. game is. Yeah. So then you start to really get into the nitty gritty of like what neurotransmitters are you targeting more. So there are some like venlafaxine or paroxetine that have more of a norepinephrine effect, which is really what helps you with that adrenaline and helps with that impulse control, which is lacking in those dogs that have that really high octane activity. So based on the whole problem list of that animal, we will choose like, are we focusing more on that norepinephrine or is it dopamine? That's where we'll start to make those choices. Knowing though that the dogs don't read the textbook. So even though we might use those logical thoughts to make our choices, at the end of the day, an individual's brain might not follow what we think will happen. And if it doesn't, I, again, don't want you to be discouraged. Sometimes it takes a few tries of trial and error before you find the right exact fit for your dog or cat or human.
Awesome. Okay, can you overdo the non-medical options like the calming supplements, calming chews, zesty paws, etc.?
Yeah, I don't know that you could overdo anything technically. My only caveat would be that there, because a lot of those products that are out there, again, are not regulated, I wouldn't have the confidence to say it has zero interaction guaranteed 100%, if that makes sense. Because if there's other additives or there's different levels, of that product and it's not listed, I unfortunately am not going to be able to know. So it will always be a question on my mind of like, well, if this dog is not responding the way it should be, which one is it and what part of it is it? I don't think you can, again, necessarily overdose anything technically because they're natural products. But I would defer to like a veterinary professional prescribing to make sure they feel everything's being managed appropriately to balance.
Yep. And it can also be hard if you throw in seven different, non-pharmaceutical options all at once. It's
Yeah.
hard to know if any of them are actually helping or if something's helping what is. And so you might end up spending a lot of money that's not all that helpful for you.
Yeah, and that's a great point about the money. The natural products, the tipping point that I find a lot of times is that yeah, you could go higher or you could use more, but it actually starts to add up really quickly. And the point of medication is that we have really concentrated the specific neurotransmitters we're aiming for so that like one tablet gets you so much more than if you gave like turkey all day long, right? So that's the way you might want to shift that goal and focus is, hey, at some point, the cost benefit doesn't really calculate out well.
Awesome. Okay, great question about Trazodone and why some dogs have that sort of adverse or panic or paradoxical reaction to Trazodone.
Yeah, yeah. So, my mentor is Dr. Amy Pike, and she, in our clinic, she'll say, "Oh, that dog's Trazostoned," as like the way we joke about it. So the reason that I think some of our dogs, it's not the best fit for some of their triggers is that it can make them feel different, right? Like it makes them feel in the lower dosages, it actually activates more of your H1 receptors, which is like your histamine, right? So it can have that sedating effect. And if you think of like someone who was out partying and they're like kind of starting to feel it a little bit, and then they're just like really extra like alert for everything, that's kind of what I equate to a like a drunk dog on Trazodone. That doesn't happen for every dog and for every dose. It can have a very dose dependent effect. And so again, under the guidance of someone who feels comfortable with Trazodone, that may not truly be the right fit for that dog, or maybe that's not the right dose for that dog or that particular setting. Sometimes you just need to add other medication that works at different neuroreceptors to really balance everything out. But that's why you see them sometimes act a little bit more on edge because they're feeling a little bit loopy or sedate. And then it makes them feel like, okay, I'm uncomfortable in this situation. I have to like, act and be more on alert, if that makes sense.
Absolutely. Okay, another elevator speech question about how pain affects behavior. So if
Mhm.
people are really struggling to understand that pain might be causing some of their dog's behavior?
Yeah. Well, first off, I said I don't have any, so y'all asking me this is not helpful. No, I'm just kidding. But with pain and behavior, I would say think about any time you've had a headache or a hangnail or anything that hurts you. If you don't feel well and someone's like, "Hey, what do you want to eat for dinner?" I don't know, figure it out, right? Like when your head hurts, you don't want to deal with all these other things that you might have been able to deal with better before. And so that concept of trigger stacking certainly applies here too. The pain is definitely going to increase the baseline that that animal is starting at. So as more triggers get added on, they're going to have less ability to cope with it. So addressing the pain is going to help. I'm a migraine sufferer. So when I have a migraine, I don't want to answer 5 questions. I just want my day to end and I get to go to bed, right? So that's how I would think about pain and behavior.
I have my recent spiel has been that a good friend of mine who has a master's in applied animal behavior and is a behavior consultant has a lot of cases of aggression and anxiety that have already been through multiple trainers. They can't figure out what's going on.
Mhm,
And she's been finding a lot where once they do diagnostic tests, they're finding that there is an underlying health condition.
mhm,
And the one that really kind of stuck in my mind that I've told clients recently, there was a dog who suddenly stopped like wanting to get into the car or something like that.
mhm.
No visible signs of pain, but just
Right.
suddenly some weird behavior quirks.
Yep.
And the dog ended up having multiple broken ribs when they did x-rays. And they weren't seeing any like obvious signs of pain except for certain pieces.
Oh my
And
God.
she pushed and said, like, I really think there's something that might be going on. So, we think like, oh, well, he's not limping and he's
Mhm,
not crying, like he's
mhm.
probably fine. But
Yeah,
sometimes dogs are very stoic and we might not realize it. So
yeah, yeah. Good
not that
for
everyone
her.
has broken ribs, but like if
Yeah.
someone had broken ribs, like if I have a headache, everyone within a 2 mile radius knows it, but some of our dogs do not share that information well. So
Yeah. And I mean, I would say good for her for advocating for her dog and saying this is not normal for him. You need to do more.
yeah,
Because that's exactly right. And we do see it impact everything that they do, and they're going to try to hide it. And even if you go to your vet and they try to do an exam and they're uncomfortable, how stiff is that dog trying to like resist all the manipulation? Sometimes it takes a sedated exam, right, to make that dog's be relaxed enough to show where it really hurts, right? So yeah, that's a great example though.
absolutely. Okay. What kind of medications do you recommend for sound sensitivity?
Sound sensitivity, Cilio is my go-to if it is sudden onset because you can give it a first onset of like distress, right? So like it came on all of a sudden, you weren't prepared, or you knew it was coming, but it's just a fast moving thing because it's only going to last 2 hours. So I love Cilio for noise phobias. The one I'm going to a lot commonly nowadays for for noise phobias is actually gabapentin. We don't have any published research on it to my knowledge, but a lot of behaviorists are starting to see a component of associating pain and like sensory, just being more sensitive to like all of the input of like sensory stimuli like lights and sound associated with pain, and we know gabapentin has that anxiety relieving and pain relieving property, so I do commonly use gabapentin as one of my go-tos for noise phobias. So yeah, those are
Awesome.
the two. Yeah.
Okay. So many questions. Um, so many good questions. Somebody asked, I know we talked about you can't overdo like the supplements and things like that, but are there any interactions or like if I give a supplement, do I need to wait before I give gabapentin or anything like that?
Mm. Yeah, generally no. I don't see all of a sudden that you're on a supplement that's meant to help with anxiety, you give gabapentin and then something bad happens. I don't really see that often. And that's mostly because you're focusing on different neuroreceptors and chemicals, right? So I mentioned a few of those during the presentation, but yeah, I don't really see a lot of the combination of med and supplement starting to like cause this weird interaction very commonly. I do tell people though it becomes almost a waste of money, to be frank with you, because if you're at the point of using medication, then the supplement's not enough. So there's really no point in continuing to give a supplement and a medication when you're at that point.
Awesome. Okay. Um, a follow-up question for the pain, and I think this is a great one. So if you, whether you're a trainer or an owner, and you've gone to the vet because you think there might be pain, and they do like a cursory check, they do like a general exam, and they say the dog's fine, there's no pain. What do you do next? What's the next
Yeah.
step?
Um, that's tricky because that does happen often, and some of it is because we're trying to give that dog the least stressful experience at the vet that we can. And so it may again be kind of like your friend Miranda, where they have to advocate more and just keep pushing and pushing and pushing. And sometimes we have to do that in human medicine too, right? Like, how many times have you been like, no, I swear this is not normal, and your dog's like, it's fine, right? So sometimes you really have to advocate for yourself or your pet. If they say like, no, we really can't do anything else, like, but look at what they've done. Did they do x-rays? Did they do blood work? Did they work up that dog? Ask for those things. I can't think of a vet who would be like, wait, you want to do blood work? No, I'm not going to do blood work. I can't think of a vet who would say no to doing diagnostics. So if you're really worried about it, just start to like open up that conversation more and say, I am really actually quite worried because of XYZ. Would you mind if we worked it up further, doc? You know, you can even mention like I listened to a webinar, I did some more research and I found that there might be all these underlying things that could impact, and I'm worried about that for my dog. So just advocating from the standpoint of concern because you care for your dog is the best way to get through to a vet.
Wonderful. Um, we have asked you to answer so many questions. I really appreciate it. There is a ton in this world of medicine and a ton in the world of behavior. So if we didn't get to your question, I'm sorry. I know I missed some of them in there. But thank you so much, Dr. Eng, for that. And I will get this posted. So if you want to go back and check it out, definitely check that out. And I will also ask for the link again. So if anybody wants to participate in the research study, that would be super cool. If you are in need of support, again, there are veterinary behaviorists and behavior residents all over the country. You may have to search for one depending on where you are. But if you need anything in the Austin, Texas area, please let us know. Again, we are a 501c3 nonprofit. So thank you to everyone who donated for this webinar. And we really appreciate it. Dr. Eng, thank you so much for your time. Really
Oh, you're
appreciate it.
very welcome. It was my
All
honor.
right.
Thanks, everyone.
Have a
Sorry
good
for
one.
the mix up.
Bye.
Bye.